Oh, my name is Ann Nevill, and I'm a vet who's been doing normal medicine for 42 years, but I have in the last 20 years explored acupuncture and herbs. I think I should introduce it by explaining that herbs have been part of our life for thousands of years, and there's books available that talk about our European heritage of herbs. Like this is a commonly used one, or many others like it. It's called kitchen pharmacy, and there's a guy called Culpeper who wrote a very comprehensive herb compendium back in the 1500s, and at that time herbalists were generally considered to be, perhaps naturally, a lot better than doctors. But the doctors won a legal battle to prosecute any herbalist who said that they could cure things, and so the herbalists have been struggling a little bit under a legal duress, as it were. Anyway, over in China, the whole thing became a lot more academic thousands of years before that. So this is a typical Chinese book about herbs. And as you can see, there's a lot of detail. There's a picture of the herbs, so you don't get it wrong. There's their actions, their toxicities, and their medical implications. I looked at Chinese herbalism as a better way to understand Chinese therapy, because I had already found acupuncture to be very effective. Modern medicine, which is actually based on exploring these already in use herbal formulas. And we all know that people discovered that the foxglove could help some people with cardiac failure, so it became digitoxin, and it's still used today, but less so. This is quercetin, which is actually just onion. You know, it's a bit of an onion, but it resorbs swelling. And so they studied it, you know, in Western medicine, scientifically. So that's quercetin, but the Chinese would be using spring onion. So then there's things like these are apricot kernels we use because we see quite a lot of animals with cancer. But they've been known that they can help people with cancer and stagnation generally. But now we know that they have a thing that they've now called vitamin B17, and that is presumed to be the effective stimulant, you know, as it were, for the immune system. So what's happening is there's a whole heap, in fact there's many more, I think there's 4 or 5 times the number of drugs, Western drugs, which are arriving on the market from exploring natural medicines. Anyway, I got interested in the Chinese herbalism because I could see that they could alter the way the body was performing. And I look at the tongue for signs of blueness and stagnation, or pallor, in other words paleness, you know, for lack of circulation. I look at the pulse. The pulse should be a nice smooth pulse, and if you can imagine it coming in and sliding off in a nice, it's almost like a wave in the ocean. But often pulses come in and they're not smooth. They rock in and rock out, or else they don't have the depth that they should. You know, they're just trivial, sort of superficial pulses that you can just feel the body struggling. And you think to yourself, right, I'm going to alter that. But it is easy to see what's wrong with the body. It's just not all that easy sometimes to move it.
I'm Karen Castesian, and these are my 2 dogs, Callista and Tara. I've been coming to Ann for over a decade now, and the dog that we had at the time, Beasley, he was 15 years old, and I discovered that he had lumps on the glands around this area of his body. So I rang a vet in Western Australia that I knew, and I asked him about who might be the best vet for this particular purpose, and he said, you have the best vet in Australia for cancer, and that's Ann Nevill. And so I came to see Ann. She examined him, and initially she gave him the herbs, and the lumps actually went down. Tara started panting quite severely from about Christmas onwards, and we got her to Ann on a couple of occasions and gave her various herbs, but it still persisted. We came back about a month ago, and Ann did a X-ray at that time, and we noticed that there was fluid in the upper lung, which was determined possibly that it was allergies because it was coming into the allergy season, and her nose was very runny as well, and she had been coughing and sneezing a lot. So Anne has had her on some herbs for that particular condition, and also she'd gotten a little bit weighty, so she's also back on her diet of fresh vegetables and a little sheep's heart. But as you can see, they're very calm coming here. You know, it's just a very peaceful environment, and it's really all about the pets. But the most important thing I think in coming to Anne is it's such a holistic approach, and that she takes care of the pet parents as well. And you know, every time you come here, it's an experience of learning.